So what are the risk factors for postpartum mood disorders such as postpartum depression, anxiety, psychosis? My name's Courtney, I'm a nurse anesthetist, and I survived postpartum depression. So disclaimer, please talk to your doctor, especially if any of this resonates with you, and reach out for help if you think that you do have risk factors, but I'll go over 11 different risk factors. So the first one is a personal or family history of mental health problems like depression, bipolar, anxiety in yourself or family members. I had both of these things, like it runs in my family and I had anxiety history. Risk factor number 2 is hormonal changes. So there are rapid hormone changes that happen after you give birth, and you can really be sensitive to them like I am, especially with breastfeeding and weaning and stuff like that. That's when I had a lot of problems. Risk factor number 3 is stressful life events. I had all kinds of these, like moving, changing jobs. My toddler was in the hospital with respiratory failure, and that was really stressful for me. Risk factor number 4 is childbirth complications, like having a traumatic delivery. I had that, premature birth, or health issues for mom or for baby, especially like moms with NICU babies. Risk factor number 5 is sleep deprivation. So disrupted sleep because of your baby, or in our case, we had a toddler who didn't sleep for years, and it does catch up to you after a while. Risk factor number 6 is psychosocial factors like low self-esteem, unplanned pregnancy, relationship troubles. Risk factor number 7 is if you have any like medical conditions, problems with your thyroid, or chronic health problems. This can also make you higher risk for having postpartum mental health stuff. Risk factor number 8 is, like any kind of substance use disorder, alcohol, drugs, things like that can make you a little bit higher risk. Socioeconomic factors like financial troubles, unemployment, lack of access to healthcare, although there are a lot of free resources available to you no matter what your situation, and I can go over those as well. Risk factor number 10, it's important to note that race can also be a risk factor for postpartum mood disorders. For example, studies have shown that Black moms and Hispanic moms can have a higher relative risk of postpartum depression or postpartum depression symptoms. Risk factor number 11 is history of postpartum mood disorders or psychosis. It can be a risk factor for the future. So for me, I had anxiety after my first, and then it was way worse after my second. So something to keep in mind. So collectively, I had a lot of these risk factors, and being aware of your personal situation can really help you better prepare for the future. And what should you do if you read this and you're like, oh my goodness, a lot of these apply to me? Don't panic. The awareness is a good thing. And I'll make a video about what you can do. But the first place to start is really, really talk to your doctor and get medical help, get therapy, and prepare for the future.